Hello and welcome to Nicholas Children's Health System Learning and Development Choking Educational Video. I'm Linda. I will demonstrate how to help a child who is choking. If choking is severe, CPR may be required. What is choking? Choking means something such as food or an object has gotten stuck in the airway, preventing air from getting into the child's lungs. Choking may be mild or severe. Mild choking means that the child can cough and make sounds. If the child is coughing, let them cough. They're trying to get the object out. If you're worried at any time about the child's breathing, do not hesitate to call 911. Severe choking means the airway is completely blocked. The child may make the choking sign, such as holding his neck with his hand, one or both hands. In severe choking, the child is not able to breathe, to cough, or to speak. Your quick response to choking can save your child's life. You will need to get the object out so the child can breathe. If you think the child is choking, ask the child, "Are you choking? Are you choking?" If he nods, let them know you're going to help them. I'm going to help you. Get behind the child, reach your arms under the child's arms. Put one fist just above the child's belly button and grab that fist with your other hand. Give quick upward thrust until the object comes out and the child can breathe or cry, or until the child becomes unresponsive, like this. Let's try this together. Are you choking? Are you choking? I can help you. One fist just above the belly button, grasping the other. Continue with the upward thrust until the object comes out and the child can breathe or cry, or until the child becomes unresponsive. If the choking child is very large, you may give chest thrust instead of abdominal thrust. To give chest thrust, reach your arms under the child's arms, placing your hands on the lower half of the child's breastbone. Pull straight back until the object comes out or the child becomes unresponsive, like this. Let's try this together. For a large choking child, hands under the child's arms, hands over the lower half of the breastbone, pulling straight back until the object comes out or the child becomes unresponsive. If the child becomes unresponsive, lay the child down on a hard surface, such as the table or on the ground. Yell for help. Help, help! Someone call 911. Hey, you in the blue shirt, call 911. If you're alone, you'll need to provide 5 cycles of CPR, then call 911. Put the phone on speaker so emergency staff can guide you. Let's try this together. Place the child. Let's place him on a hard surface. Help, help, I need help in here. Somebody call 911. We will start with compressions. 30 compressions. Place the heel of one hand on the lower half of the child's breastbone. Push hard, push fast, counting out loud to a count of 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Let's try this together. Find our hand position, heel of one hand on the lower half of the child's breastbone, 30 compressions, counting out loud. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now you'll have to check the airway for any objects. Head tilt, chin lift. One hand on the child's forehead, 2 fingers on the chin to tilt the head back. Check the mouth to see if you see any objects. If no objects are seen, pinch the child's nose, cover the child's mouth, and attempt to breathe. If air does not go in, You need to repeat the chest compressions. 30 compressions, lower half of the breastbone. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Head tilt, chin lift, checking for objects. No objects are seen. Pinch the nose, attempt to breathe. Repeat the process over and over again. 30 compressions, opening the airway, checking for objects, attempting to breathe, over and over until the child wakes up and can cough or cry, or till emergency staff arrives to help you. This completes our video on how to help a child that is choking. On behalf of all of us at Nicholas Children's Health System, we hope you found this instructional video helpful. Thanks for learning with us.
Hi, my name is Aaron Gerbitavicius. I'm a charge nurse here at Chalk Children's Emergency Department. One of the most frightening situations that parents can go through is a choking episode with a child or infant. Today we're going to be talking about performing the Heimlich maneuver on your child or infant. We'll start with the infant. Recognizing signs and symptoms of choking in an infant look like a red face, choking, coughing, gurgling sounds. You will now see the steps of performing the Heimlich maneuver on an infant. The infant must be placed on your forearm, supporting the head with your hand. Find a place where you can sit with the infant, placing them head down and where you're able to support their weight securely. You will then deliver a series of 5 back blows, using the heel of your hand to the center of the back. 1, 2, 3, 4, 5. After this, you will then roll the child over, supporting the head, to deliver a series of 5 chest thrusts using 2 fingers to the center of the chest. 1, 2, 3, 4, 5. You will continue alternating between 5 back blows and 5 chest thrusts until the object becomes dislodged. Make sure to call 911 to render emergency services for your child. Now we will learn how to perform the Heimlich maneuver on a child. First, we will need to determine how do we know if the child is choking. You will see the child put their hands up to their throat, like this, showing that they are choking. This is the international sign for choking. If the child is sitting, have them stand up and explain to them that you are going to perform the Heimlich maneuver. You will now get a walkthrough on how to perform the Heimlich maneuver on a child. The Heimlich maneuver begins by wrapping your arms around the child. Then make a fist. Put the knuckle of your pinky finger into the victim's belly button. Then roll the fist upward until the knuckle of your thumb is touching the belly. Grabbing your fist with your opposite hand, thrust in and up. You will repeat this in and up, in and up, in and up, until they dislodge whatever is causing the choking and they can breathe again. It is important to remember to call 911 to render emergency services for your child. Thank you for watching this video. Here at Chalk Children's Emergency Department, we recommend that all parents take a child life safety course in basic life support and CPR.
Welcome to Saving Lives with Gus and your host, Dr. Raj Ruparel.
Hi there, we're here in Mayo Simulation Center's mock operating room again. You may remember Gus from our Heimlich maneuver video. At the end of that video we said don't perform that maneuver in infants less than 1 year of age. Well, Gus Jr. is waiting for us in the control room. He's going to help us demonstrate. Let's go. This is the control room where we can run, lead, and record simulation-based scenarios for education purposes. But today we're just going to be working with Gus, who's going to help us out with infant Heimlich. To perform this maneuver on an infant, here's what we do. Support the head and body with our hand and forearm, careful not to cover the mouth. Flip them over, supporting with our leg. We're going to deliver 5 back blows with the base of our palm. We flip the child over, again supporting the head and body with our hand and forearm, We will now deliver 5 chest thrusts with 2 fingers between the nipples. And we will repeat this process until help arrives or the object is expelled. That's how to perform this maneuver on an infant. Do you remember how we perform the Heimlich on an adult? Thanks for watching. Pass this on to a friend.
So what do you do when someone's choking? Say you and a friend are out in a restaurant and all of a sudden they start choking. So I'm gonna have my friend Hannah come over here. And we're out, we're having a good time, we're eating, and all of a sudden she seems like she's choking. First you ask, are you okay? And oftentimes the international sign for choking is this, okay? They're like, I can't breathe, something's going on. If you're around other people, you want to get them to help you. You want to, if you're in a restaurant or a place of business, have someone call out for help and have people help you out. Tell them what you're doing. Don't just attack them because that will just heighten their anxiety and their panic. So what you're going to do is you're going to stand behind them and you're going to wrap your arms all the way around, okay? And you want to you find their belly button with your pinky, make a fist, put the pinky on the belly button, then roll it up so your thumb is, the knuckle of your thumb is right there. And then you thrust, you pull it in and up, and I'm not going to do it as hard. In and up until they can dislodge what is in there and they can breathe again. Don't go crazy like in the movies and start slapping their back and like wrestling. Sometimes people get carried away and they want to slap your back and they just end up hurting you. If the person is pregnant or a larger person, and you can't get your arms all the way around to where their belly button is, you're going to want to go higher up to where their breastbone is. So say Hannah is pregnant, congratulations. You wrap around, you find their breastbone, and then you just do the same thing, in and up until they dislodge whatever is in their throat and they can breathe again. If the person is so big, if you're a small person and you have a big strapping person with you who's choking and you just can't even do that, you can assist them into doing a self-Heimlich maneuver on a chair or a surface that will get to their diaphragm. You just lean them over and kind of talk them through it. Stay calm. The more panicky you get, the more panicky they're going to get. They're already in a state of anxiety because they can't breathe, which is normal. So if they lose consciousness and they fall to the floor, you're going to lay them down, you're going to roll them over, and then you're same thing. You're going to find the belly button, roll up, and you're going to thrust while they're on the floor until that comes out or until help arrives. Continue trying to do the thrusts and trying to get them to get that out of their throat so they can breathe again, and just stay with them until help arrives.
It can happen in an instant. 1 minute there's friendly conversation around the table, the next minute someone's choking.
Are you okay?
According to the National Safety Council, roughly 5,000 people die from choking each year. Josh Mockley, a Mayo Clinic cardiac nurse, says when you see someone choking, it's important to remain calm as you let them know you're about to help.
So you want to place the thumb side of your fist against the person's abdomen, and then you want to apply the other hand on top of that, and then sharply apply pressure to relieve the air.
It's called the Heimlich maneuver.
1, 2, 3.
Mockley says to repeat the process until you see the object they're choking on come out of the person's mouth.
1, 2, 3. Are you okay?
Oh, yeah, thank you so much.
Yeah, you're welcome. Glad you feel better.
Yeah, thanks.
If the person loses consciousness before the object comes out, make sure someone calls 911 for help while you continue to work to clear the person's airway.
1, 2.
For the Mayo Clinic News Network, I'm Ian Roth.
A stroke can occur when the blood supply to the brain is disrupted and starves the brain of oxygen. Strokes are most commonly caused by a clot that blocks the flow of blood to a part of the brain, although some strokes can be caused by a ruptured blood vessel that causes bleeding into the brain. Call 999 or 112 for emergency help immediately if you think someone has had a stroke. If you suspect someone is having a stroke, you can use the FAST guide to identify the key signs. F stands for facial weakness. Look at their mouth or eye. They may be droopy and can't smile evenly. A, arm weakness. Ask them to raise both their arms. They may only be able to raise one. Can you raise both arms for me, please? S, speech problems. They're unable to speak clearly or might not be able to understand what you're saying to them. Ask them a question, such as, what is your name? Can they respond appropriately? Can you tell me your name, please? T, It's time to call 999 or 112 for emergency help and tell them you suspect a stroke after using the FAST guide. While waiting for help to arrive, keep them comfortable, supported, and reassure them. Do not give them anything to eat or drink because it may be hard for them to swallow. Keep monitoring their level of response until help arrives. If they become unresponsive, prepare to treat for an unresponsive casualty. So remember, to help someone who has had a stroke, use FAST. Facial weakness, arm weakness, and speech problems means it's time to call 999 or 112 for emergency help. And that's how you help someone who's having a stroke. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
A stroke is very serious and needs to be treated right away. You'll commonly see this in elderly people, but you can see it in all ages, in all walks of life. You want to diagnose it quickly, and you want to get help quickly. So what is a stroke? A stroke is a stoppage of blood to the brain. It can either be through an obstruction, which is like a blood clot in the brain, or it can be through hemorrhaging. Something is bleeding out and you're not getting enough blood to the brain. So what will you see? You'll see numbness, you'll see tingling, you'll see vision disturbances, you'll see trouble speaking, trouble understanding speech, trouble walking, dizziness, confusion. Sometimes you'll see a sudden severe headache that comes out of nowhere. So what are some of the signs that a person displays? Here's what you can do. You can have the person smile. You can have the person stick out their tongue. You can have the person raise their arms, and you can have the person speak to you. With a stroke, you're going to see one side crooked. Their tongue will be crooked, their smile will be crooked. Sometimes they can't even raise one side of their face. They'll have trouble walking and maintaining balance. You want to get help right away. The faster you get medication, the faster you get treatment, the better the outcome of a stroke is. Call 911. Tell them, I think my friend, I think my family member, I think someone's having a stroke. With a stroke, every minute counts. Every minute that you're in the house, every minute that you're in transit to the hospital, and every minute from when you get to the hospital to when you get to the stroke unit. The faster you can get them treatment, the better their recovery will be.
Hi, I'm Josh. I'm a nurse here at Children's Hospital Boston Emergency Department. It's summertime and children and families are out playing, especially in the water. And here at Children's Hospital, we are seeing a rise in water-related emergencies. So we thought we would take a moment to review the steps of basic CPR with you. The first step of CPR is to assess if the person is awake or not. Are you okay? Are you okay? If there's no response, you should shout for help or send someone for help. If no one's available to help you, you must act. Time is very important when trying to save a life. The first thing you want to do is remove the clothing so that you can work. Open the airway by doing a head tilt chin lift. You want to lift with your fingers on the chin and hold the head at the forehead with your other hand. And you want to lean in and you want to look at the chest, listen for breathing, and feel for any breath against your face. And do that for about 5 to 10 seconds. If there's no breathing, you need to give 2 breaths by pinching the nose and making a seal against the mouth. You should see the chest rise with each breath that you give. The next step is to check for a pulse by using 2 fingers on the side closest to you. You should check for a pulse for about 5 to 10 seconds, and if you don't feel a pulse, you need to start with compressions. Place the heel of your hand between the nipples on the chest, right over the breastbone, and interlock your fingers together. And you should push 1/2 to 1/3 the depth of the chest. And you should do 30 compressions. 1, 2, 3, 4, 5. As a nurse, I've taken care of many children that have come to us after suffering a near drowning and they've been pulled from a body of water and had CPR performed by family and friends. Knowing just a few basic steps of CPR might help save your child. 9, 30. Continue with cycles of 30 compressions to 2 breaths for 5 cycles. And if help hasn't arrived after 5 cycles, you can leave the child to phone for help. When you return to the child, you should continue with compressions and breaths until professional help arrives. And remember, this is not a substitute for a formal CPR course. We urge you to sign up for a course in your community, and you may be able to save someone's life.
You arrive on the scene. Check the scene for safety. Check the victim for consciousness. Gently tap their shoulder and shout.
Are you okay? Are you okay?
If no response, call 911 immediately.
You, call 911.
If the adult is lying on their stomach, turn them over into their back. They should be lying on a hard, flat surface. Check for breathing and signs of life. Watch their chest for any normal movement. Look for signs of life and breathing for no more than 10 seconds. No breathing or signs of life, begin CPR. Position the heel of one hand on the center of the adult's chest. Place your other hand on top. With your elbows locked and arms straight, lean over the adult's chest and compress the chest 2 inches in depth, 30 times.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
After 30 compressions, give breaths. Give breaths by tilting the head back, lifting the chin, and pinching the nose. Place your mouth over theirs and give 2 slow, gentle breaths, just enough to make their chest rise. Continue with 30 compressions and 2 breaths.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Continue CPR until you see signs of life, another rescuer takes over, or help arrives.